Introduce our next guest. Let me see where David Tabatadze and Paul Weiner from ZATA Pharmaceuticals, correct?
That is correct,
Yes,
yes.
sir.
Closer to the mic, please. So why don't you tell us, welcome, why don't you tell us about ZATA?
Yeah, thank you for the invite, number one. ZATA Pharmaceuticals is a company that David Tabatadze, Dr. David Tabatadze, and a Dr. Paul Zemechnik started in 2008. And in 2008, they've been, since then, working to advance the technology. The technology relates to oligotherapeutics, and in more particular, antisense oligotherapeutics, which has been around for about 25 years. There's a number of companies, about dozens of companies solely working on oligotherapeutics to get these biopharmaceuticals into the market, as there's many diseases and infections that they can help with. And Dr. Zemechnik, he passed away in 2009, just after they formed the company. And prior to that, Dr. David Tabatadze had been working with him for 15 years, advancing this technology. So, so David and Paul worked together very closely for 15 years, Paul teaching David pretty much everything he knew about antisense oligotherapeutics. So there's a number of patents that they have. They've done a lot of work on the technology, and now it's ready for its next phase. How antisense oligotherapeutics works is it goes after cells that are actually behaving badly. So there's certain cells that
I know a lot of cells that misbehave.
So the genes that you're born with and
Right.
others cause these infections and diseases. So the antisense oligotherapeutics makes it so these cells become inactive or blocked, so they're turned off and they can't cause harm to the body. And so there's all these companies working on this technology. It's very exciting technology, but there's some underlying problems with the technology. All the oligotherapeutics, the antisense oligotherapeutics, and that's where ZATA comes in. ZATA has come up with technology that will penetrate the cells, because cells are naturally negatively charged and the oligotherapeutics are negatively charged. So you're not able to get the oligotherapeutics into the cell to turn the cells off. With this new technology, it causes these oligotherapeutics to be either positively charged or neutrally charged, to be able to penetrate the cells and then block the cells from behaving badly, if you will, and stop the cancers, HIV, allergies, a number of different applications that they could be used for. That's the basis of their technology.